Good evening, our listeners out there. I'm Dr. Taiwo, consultant gynecologist, Limi Hospital, Abuja. Here with me is.
Dr. Blessing, personal physician, Limi Hospital, Abuja. You're welcome.
Thank you. This evening, we'll be discussing family planning. We have had a time, probably that should be about 2 weeks ago, we have had to discuss family planning before, but based on popular demand, and it's an important topic which we don't get to discuss often. Some people are not even able to even come and ask for it. There have been requests that we should still discuss this further so that more better information can be given to our listener out there, and it can be of help for as many people who are having challenges opting for family planning. So this evening we are going to continue from where we stopped. We'll still be discussing various form of contraceptive method. Why is it important for us to actually have to make use of contraception? That is why we are here this evening to equally discuss this. I will be glad to have you listen attentively to us. We equally appreciate your questions because that will help us to make it more interactive, and it will be more beneficial to all of you, our listeners out there. So thank you.
Thank you so much. Okay. So, Taiwo, let's know something about like the statistics for family planning, like worldwide, because it's a very hot topic, the population in the world today.
Well, I want you to understand that family planning is important in the world where we live today. Just a couple of years back now, Nigeria was saying, oh, 98 million. At the time, we're saying 160 million. Later, we're saying 200 million population in our home country. And a few months back, we're like, oh, 206.1 million. But as at this month, November 2023, our population is estimated to be 217. And the world population currently is about 8 billion, of which today, per day in the whole world, about 120 million acts of sexual activity occur daily, and out of which, you have like 910,000 pregnancies occurring from the 120 million pregnancies, sexual activity that occurs daily. So when you look at it, most of these pregnancies are unplanned, unwanted, and they result about 39% of them will result in unwanted pregnancy, and unwanted pregnancy are actually the reason why people go for voluntary termination of pregnancy, which we call abortion. And abortion carries its own risk, complication. People are dying from abortion. Some people have their womb damaged from abortion. Some people have their kidney damaged during abortion. You understand? Some people cannot even get pregnant in the course of abortion. So contraception is actually a key strategy that helps in preventing unplanned or unwanted pregnancy. That is why it becomes very important, because especially for couples, you understand? Couples, what's the one of the reasons for marriage is what? For sexual pleasure, for having children. So when we are having our sexual pleasure and we don't want to have children, you understand? Then we should use things that can help us to prevent unplanned or unwanted pregnancy that most people end up aborting. Of which in our country today, why it becomes important is that abortion is legal in our country. It has not been legalized. They are having issue in the United States of America now because they abolished the abortion law, and there have been protests for months in US now. So that is why we are talking about it, so that we will prevent all these the psychological impact of unwanted pregnancy.
So that means if there's any takeaway for our viewers today, the best for unwanted pregnancies is best to be prevented than trying to go about abortion. So we believe that if you stick around to the end of this Insta Live session, you'll get to know the many various ways that you could safely prevent pregnancy.
No, that's true. We are in the preventive. We are at the era of preventive medicine rather than curative. So we don't want it to happen. Sometimes you might not be able to prepare it, but we don't want it to happen. And in Nigeria today, in Nigeria as at about 4 years back, for the few number of people that are using family, contraceptive family planning, about 2.16 million unplanned pregnancy were prevented. And out of which, it saved about 771,000 unsaved abortion. And it reduces the maternal death, which we call maternal mortality. That's the death related to pregnancy, about 13,000. Is a lot. What about if we now have up to like 70 or 80% of women that are expected to use contraceptive are on it? It's going to reduce the maternal mortality of Nigeria, which is ranked as like the top in the world. We contribute just about 2% of the world population, and we are contributing about, we are like number third of the maternal death in the whole world. So this is another measure.
So our viewers, please stick around to the end so you can get to know all the many ways you can safely prevent pregnancies through family planning. So our viewers would like to know what family planning is.
Well, if you look at it, people have erroneous information that family planning. I've not even given birth. You're asking me family planning. No, it's just a way of thinking and living that is adopted voluntarily upon the basis of knowledge, attitude, and responsible decision by individuals and couples in order to.
Okay, my name is Dr. Blessing. Once again, if you're just joining us, we're discussing family planning. Dr. Taiwo is here with me, consultant obstetrician gynecologist from Limi Hospital. Please stick around with us and get to know more about family planning.
Thank you. So we're trying to discuss to define family planning, and it's like I said before, a way of thinking and living that is adopted voluntarily upon the basis of knowledge, attitude, and responsible decision by individuals and couple, in order to promote health and welfare of the family group and thus contribute, effectively to the social development of the country. So that is what we mean by family planning. It's not just only about preventing pregnancy. There are benefits from it, which we'll still be talking about, the benefit of family planning. Of course, when you look at it, when we are now talking about family planning, of course, contraception, very important. And what it simply means is just that it's a deliberate interruption of the processes that leads to pregnancy. So that in the course of after we have had sexual pleasure, we want to prevent, all the processes that leads to pregnancy. And what about it? The process that leads to pregnancy is that the egg that a woman releases and the sperm, which contains the spermatocyte that the man releases through ejaculation, they need to meet together, to come together, to form, to fertilize the egg and form a zygote. So that is the processes. And after that one, the fertilized egg, which you now call the embryo, needs to enter inside the womb and continue to develop there. So all those processes are what contraceptives try to interrupt so that pregnancy doesn't result. So that is it.
So I'm very glad to know that family planning is all about responsible decision making. As we know, decisions decide destiny, and the best tool for decision making is information. So we're here to give you all the information you need on this family planning line. Okay, so we should talk about different contraceptive methods.
Yes, when you are talking about contraceptive method, there are natural method, there are modern method. Sometimes when we ask people, are you using any family planning? No, I'm not using. But in one way or the other, some use natural method. The issue with them is that they are not as effective as those modern methods, especially if one is not disciplined. We have abstinence is a form of family planning. But of course, we want to have sexual pleasure. You will not say that a man who knows that, no, I cannot, I need to start making love. You understand? And one of the reasons why he's getting married, if you abstain from his wife, even if I'm doing the one, will I abstain from my wife? No, now it's not practicable.
With the rising bride price and dollar rates.
You want to enjoy, what's the fruit of your labor. You understand? You have paid a worthwhile, and in some places it's not easy to go and take a wife home. You understand? You need to enjoy. So that's one thing. So abstinence is not practicable by couples. It's not practicable by some, some people that are engaged to each other. Maybe they want to enjoy themselves. Some people, you know, their religion, their culture permits it too. You understand? So that's one thing about it. So abstinence, it has a lot of failure rates. We equally have fertility-based awareness method, such as you are talking of the cervical mucus. You want to check the consistency of the cervical mucus. Around the time that a woman is likely going to ovulate, the cervical mucus is something that can stretch. When you open your hand, it stretch to about 8 to 10 centimeter. So at that time we call it a name, but I don't need to bother our viewers. But they just know that when you touch your cervical mucus, it changes consistency. It doesn't break when you stretch it wide. So it shows that around that time the woman is likely to ovulate. She can get pregnant. What they need to do is to abstain from sexual activity from that time. If they have sexual activity, they can get pregnant. So, but how many of us can touch our cervical mucus? Some people feel irritated. So that is why the failure rate of it too is equally high.
Yeah, and we need to be reminded that many things can influence cervical mucus.
That
Like if you're
is,
taking certain medications, if you're even vaginal sex can influence the quantity and quality. Certain sexually transmitted infections and other vaginal infections
yes,
can
even
influence it.
bleeding. Some people that have some bleeding, around their ovulation time. You understand? So that's one thing about it. We equally have what we call the Billings method, when you need to check your temperature before you get out of bed in the morning. You understand? You need to check it consistently, and there will be a drop of about 0.5 centigrade. You understand? In the blood, in the body temperature. So at that time, how many people will be faithful to check their temperature, their
Yeah.
body core temperature every day, all because you want to know when you are likely going to ovulate? So that's why the failure rates associated with that too is equally high. And we are in the temperate region, where the weather, imagine this is dry season now, everywhere is hot. So the body temperature might be high too. It can influence the value that you are getting. We equally have, the cycle bit or standard day method, in which, for women that their menses are 28 days cycle and is regular, the beads we have 28 days. We have the white part that shows the beginning of menses, that contains like within 5 to 7 days, white part. So around that time the woman will have her menses. Then around the mid-cycle day 14, when the woman is expected to ovulate, is coded red. So she knows that like 3 days before, 3 days after that period of time, you should abstain from sexual activity. Or if at all you want to have sex with your husband, you understand, you should use other protective methods such as condom. You understand? Or else, if we enjoy our husband around that time, don't, maybe twin or triplet don't come.
Yeah, 9 months
You
later.
understand? Yes, that is it. So, how many people can faithfully try to observe that without forgetting their days?
Yes.
Sex, the most enjoyable sex is when it's spontaneous.
And unplanned.
You understand? We don't plan for it. Oga is happy with madam, madam is happy with Oga, and then as we are gisting, talking, and the likes, one thing leads to the other one, and the two become one. So that is it. So is equally associated with high failure rate. So that's one thing. And we equally have some ovulation predictor devices.
Yeah, most
You
of
know,
the apps now.
the apps now.
Yes.
We have apps. People try to look at when am I ovulate or not, for especially for those people who often forget, they don't know how to note down their cycle length. So their ovulation predictor apps equally helps them to remember their cycle, and they can target it when not to have sex. So it can equally help them. But stop. Our brains are not computer. They can forget sometimes.
Exactly. So what if I want to combine all these methods?
It's possible. Yes, it makes it more effective. That's one thing about it. And we equally have some other methods too. The modern method, you understand? We have the hormonal method. Of course, the hormonal method, we have the HORA, the one that everyday pill is there. The one that contains both estrogen and progesterone, the one that contains only progesterone that can be taken every day. But the issue with it is that most people don't like the only food that we enjoy, the only drug that we like to eat every day is food. Anything other than food, nothing else. So many people can forget their pill. We call it miss pill. People who have miss pill, of course, for combined oral contraceptive pill, it has a number of pill that you can miss. For progestogen only pill, it has a number of hours. If you miss more than 3 hours, then it will not be effective again. You can get pregnant. That is why some people will say, yes, I'm on the family planning, but yet it failed. Have you used it as prescribed? That's an issue. We equally have the injectable, the 2 monthly injectable, the 3 monthly injectable progesterone, progestogen only injectable is there. You understand? So we equally have the implants, the 3-year-old implant, Nesplanol, Implanol. We have the 5-year-old implant, like Jade that has two rods. Every 3 years or 5 years you replace it. That's one thing about it. We equally have the implant, the intrauterine devices like copper T. We have the one that contains hormone too, that can be put inside the uterus, that can last up to 5 years. So it's equally there. And we have some that we call vaginal rings. In fact, these days now we even have the one that contains both estrogen and progesterone. We have the one that contains only progesterone. The vaginal rings. And they can be, for some, you can use it for 3 months before you replace it. For combined estrogen progesterone vaginal ring, you use it every week. You change it, and the fourth week you don't use it, but they are not readily available in the market now.
So, Dr. Tayo, about those implants, you said, because I'm so sure some of our viewers who are not aware will probably be imagining something as huge as breast implants. Like, just go into these implants in more detail. How is it and how convenient is it?
Implant, what we do when it comes to implant, I mentioned before that we have the one that can last for three years. After 3 years, you need to remove and replace, or 5 years. After 5 years, you remove and replace. You understand? What we do is that we put them under our skin. We can equally feel it, that that you are well kitted, you are well protected. Let Oga come. Shey is Mr. Ronaldo or Mr. Messi, he cannot score goal.
Yeah, you put on the full armor.
And making they continue now. No, you not go score. So that's one thing about it. So we do that and we put it inside the non-dominant hand. Not up to the armpit, but around the middle part of our arm. That's where we put it. Nobody knows. Oga may not even know that you have it there. Nobody knows. It's you that knows that you put something there, and it's only just little mark. If you are not careful, you may not even see that somebody has something there. That's it. Very effective. In fact, if you are asking, the implants are they are actually one of the most effective modern contraceptive. Failure rate is just about 0.05 percent.
Okay,
That's it.
would you say that the effectiveness is also based on the fact that it's really very convenient, so it's easy to be compliant with because it's already there. It's not like pills that you have to remember to take.
That is one of the reasons why most women opt out for it, because we call it like fit and forget. You fit in there, you forget. You already mark it that in the next 5 years or in the next 3 years, I want to go and remove it. That's all. And you're enjoying yourself.
That's awesome. So there are lots and lots of methods that we can do family planning. So if you're just joining us, we are discussing family planning, series 2 on our Insta Live here with Limi Hospital and Dr. Blessing, Dr. Taiwo, obstetrician and gynecologist. So we're getting down to all different methods of family planning, and now we're at barrier methods.
Yeah, we have a barrier method. Of course, this is one of the oldest family planning that we are used to. You understand? But it's equally associated with a lot of failure rates. The barrier method, if you ask which one, condom. And sometimes jokingly we say condo. You understand? So that is just it. Especially male condom. That is what is readily available. There are a lot of modification, and now people are enjoying using it too. But it's equally associated with a lot of failure rates. The challenges with it is that a little interruption with lovemaking, because the man has to use it when he has erection, and the erection must not go down before you remove the manhood from the woman. So it's important. But it's sexual pleasure that you want to enjoy and delight. Sometimes in the course of removing, sperm can spill into the vagina, and those one, there are fast runner that they are running to go and meet up with the egg. So that's where a woman can actually get pregnant. It requires discipline, consistent use, and you need to use it the way as prescribed. If you use it any other, you don't enjoy it small, you now remember, I've not put on my protection, I want to use condom. You don't pass something there now, and those things you can wash them out completely. Some will have entered. So that's the issue with it. We equally have the female condom, not readily available, but it's equally in the market. So the woman is in charge. She put it in too before the onset of love making. So that's one thing about it. We have some other ones that have been used in the past, such as diaphragm, we call some cervical cap. They are just there to block sperm, to block the cervix, which is the mouth of the womb. You understand? So they now use what they do is they prevent sperm from entering inside the cervix that will now go inside the womb, which is the endometrial cavity, and through the womb into the fallopian tube where fertilization occurs, where egg and sperm meet each other and form pregnancy. So that's one of the things. And we equally have some have used what we call spermicide. That spermicide is toxic to the sperm. So you put it, the woman has to put the spermicide inside the vagina, and then when you are making love, as it's releasing, those spermicide, they are like poison to the sperm. They kill them and prevent
So the
sperm.
barrier methods like diaphragm and cervical cap are best used with spermicides.
That is it. It equally helps to improve, but they are associated with a lot of failure rates. So we don't really encourage, some of these things now. So, well, I think I've mentioned something about the copper tea before,
Yes,
but the copper tea is one of the commonest family planning that is being used, you know, in our present world today. So it's something that is long lasting. It can last up to 10 years before you change it. There are some they were designed to last for 8 years before. But the ones that are in circulation these days, they usually last for 10 years. And after 10 years, you need to come and remove it. We equally have hormone containing intrauterine device that we can insert in the womb like copper T too, but they contain hormone like a levonorgestrel intrauterine system. We have different forms depending on the maker. So that one too is equally there. And now we equally have the permanent method.
Of course, we do. For those who have completed their family size and are very sure they don't want to have any more children, they can choose to be sterilized. Those are what's called the permanent methods. And you can tell us more about that, sir.
Okay, permanent method, of course, bilateral tubal ligation. There are different types how a woman can tie her tubes if the couple have decided that they don't want to have more children. So we can do bilateral tubal ligation. We tie the tube, or what some people will call turning of the womb. So that's it. But we equally have the one that we call it vasectomy. We cut the first difference of men. You understand? Why they know that they don't want to have babies again. You understand? But how many men out there? We are calling on I'm a man. We are calling on our men. Yes, it's an option too. But if you cannot do, please allow madam to come and take something. When madam has taken up a form of contraceptive, oga too will enjoy better. Now oga will start asking, madam, please don't break my back. I don't do, it's okay. It's okay. It's okay. And the woman too can enjoy. Not like most women that now until their menses come, that is where they will breathe a sign of relief. That, hey, God, we didn't remember to use our condom the other time. As he was bringing it out, he has released. I told him not to release until menses come. Madam knows that no, belle no enter. So that's why some women say they are hitting, but it looks like they carry. They are not gaining weight because they are under tension. It's only Oga that is enjoying.
Yeah, because
Our listener out there, especially the woman folk, please let us not leave the pleasure of sex to men.
Exactly.
We need to enjoy.
Exactly.
Because marriage is for both husband and wife.
It's a partner.
That is it. Thank you.
Family planning takes the pressure and anxiety out of your sexual life, so you can relax and enjoy your sexual life with your partner without being bothered about how you probably get pregnant and have to go and take it out or something.
Honestly,
enjoy your partner.
You know what's one of the challenges today is that instead of couples to opt out for, contraceptives, most people are using what we call emergency contraceptive. You understand? Which medically, why we have such form of a contraceptive is just that when you have an unplanned, unprotected sexual intercourse, that is when, and you are not on any form of, effective contraceptive method, that is when emergency contraception is recommended. Or sometimes when you are taking up some form of contraceptive, but it might not be up to the time that they will have started acting. You understand? That is when we want to use all these other forms of contraceptive. You understand? But that is what some people are using now.
Like the name implies, it's emergency contraception, not like daily regular use contraception. It should only be used in case of emergencies, like Dr. Taiwo said, when you have probably started using a contraceptive and it's not necessarily working, or you had an unprotected sexual intercourse and you think it's about your safe period and you could probably get pregnant from that. It's not supposed to be used as regular contraceptives.
Yes, you see women using Postinor, Postinor 1, Postinor 2.
Yeah.
So
Yeah.
people will use it like 3 or 4 times
Yes.
in a cycle.
We broke that table, yes.
For those people that are doing that, it means that you need to be on an effective contraception.
Exactly.
I'm telling you, stop using Postinor every now and then. Go and opt out for one. If we are not saying you should choose right away, come, let us interact with you. We run family planning services every from Monday to Friday in Limi Hospital,
Yes.
Central Business District,
Abuja, yes.
8 to 5 p.m. We are there. You can come. You can interact.
Exactly.
That's just it will help us. Other form which people don't really use these days, but it's something that we encourage. Is what we call intrauterine contraceptive device. Copper-T. It can be used as a form of emergency contraception, and you can continue with it.
Yeah, so you just convert it to your regular contraception.
Very important. So that is it. Okay. So we've been talking about contraceptive method, and the likes. But generally they have a way of acting. Uh, to our viewers out there, we just want to summarize how they act.
Exactly.
But if you need family planning services, you have more time of this interaction if you come around.
Yeah, to Limi
So that
Hospital.
to Limi Hospital, so that we
Yes.
can discuss it better. We can't exhaust contraceptives here.
Not in a 1 hour line.
No. No, that's one thing. But generally, how do they act? They prefer ovulation. What we call ovulation is that, at the beginning of menstrual cycle, there are a number of eggs that are developing in a woman's ovary, which we call bags of egg. You understand? There are a number of eggs that are developing, but most time, only one of them will get to maturity and get released at the middle of their cycle. Take for example a woman who menstruates every 28 days. She's going to ovulate around day 40 of her cycle. So it's only one. So what family planning does is that one of the mechanisms by which it prevents pregnancy is by suppressing ovulation, so that you don't get to release egg at all. So that's it. And such the example of type of the method of contraceptive that does that is hormonal method, like a combined oral contraceptive pill, like depo-medroxy, progesterone acetate. That's the 3 monthly injection. You understand? That can be given in the muscles or in the under the skin, into the subcutaneous tissue, into the fat. You understand? So that one is there. We have the 2 monthly injection too. Also the implants, like Implanol, Jaden, Esplanol. They do that too. So that's that. We equally have some too, like equally too, lactational amenorrhea.
Yes.
That is for a woman who has just delivered. The first 6 months, if they are doing exclusive breastfeeding, they are less likely to have their period returned. So once their period has not returned, it's protective. In fact, if a woman is fertile and her period has not returned, she's breastfeeding like 8 to 12 times a day, it can protect them from unwanted pregnancy. And that is why we equally emphasize in our own hospital, Limi Hospital, Central Business District, to all our delivered newborn mothers, you understand, we encourage them exclusive breastfeeding. It's beneficial to their baby, it's beneficial to them too. So that is it. That's one thing about it. We equally have some method too that actually prevent sperm from reaching the eggs, such as tubal ligation, vasectomy. That's the permanent method. So we have all those one, and equally some the progesterone containing pill, like they can equally cause thickening of the cervical mucus and make it.
Sperm can swim up there.
So that's one thing. We have the method too that equally prevents implantation of the embryo, that is a baby that has been formed, now entering into the uterus to get implanted and
Can
start
sit
growing.
there.
It cannot sit down there, such as intrauterine contraceptive device.
Yes.
So that's one thing about it. Also, some methods, like take for example diaphragm, condom, and cervical cap, they prevent, they can allow sperm,
Enter into
like the diaphragm, cervical cap, spermicide. They can allow sperm to enter inside the vagina, but they
They
will
will not
prevent
get
it
to the
from
cervix.
moving inside the cervix and upward in the uterus. So that is that. And sometimes too, we equally have the ones that like condom. Yes, it will prevent sperm from being released into the vagina.
Exactly.
So male and female condom, they do that.
That's awesome. So we're still discussing about family planning. We expect to get your questions in the comment section. Please, okay, we got a question now. So someone has a question. Why do contraceptives fail? We'll actually get into that, but since the person has asked us, let's go ahead and answer that question. Why do contraceptives fail? In your opinion, sir, you're an expert.
See, why contraceptive method fail most time is because the claims that is using contraceptive are has failed to do the right thing. When you don't use a contraceptive consistently, and the way it should be used
Correctly.
correctly, it is going to fail. Take for example, you are supposed to be taking everyday pill, oral contraceptive pill every day.
By 8
You,
a.m.
that is it. Then you now miss your pill 2 or 3 days. That means it will fail. It is not the contraceptive that has failed. We are the one that the client is the one that has failed. If it is mini pill, that is progesterone only pill,
3 hours.
if it's more than 3 hours, you did take, then you are likely going to get pregnant. If it is 3 monthly injection, that is by 13th week, latest by 14th week, you must take another one. You delay it beyond 14 week, wow, you can get pregnant. It's not the contraceptive, you are the one that has failed. Your implants, that is supposed to be renewed after 3 years, you did not renew it, then it's going to fail.
Yeah, because it's worn out now.
Yes.
Not anymore of the hormone.
The same thing goes with IUCD. After 10 years, you are supposed to renew. You understand? Yes, to some extent, it can be used for up to like 12 years. But we encourage that after 10 years and you are still seeing your menses, you have not entered menopause, you should remove and put another one. So that's one thing about it. However, most times, most of these, especially the one that we call long-acting effective contraceptive, they don't fail. We are the one that usually fail. Most time the failure rate is negligible. For majority of them is about 0.2 to about 0.5% failure rate. I'm telling you,
Yeah.
that's it.
So that means it requires a lot of discipline and commitment on our part, and also putting in place the systems that will ensure that you're reminded to go for a review or a renewal of your contraceptive method of choice.
Yes, very very important, very very important.
So say I want to choose a method. Now I've listened to this wonderful Instagram live and like, okay, yes, family planning is for me. Husband, we're going to going to the hospital to choose our family planning method. How do we go about this? What do we do?
I will tell us what we need to do. The mistake most people do about family planning, why people don't come and take one particular method, is because where we get the source of our information are from neighborhood doctors. And who are the neighborhood doctors? They are the sisters, the friends, our mom.
Mama Yabo.
Now, people who don't have knowledge about family planning, that have not been trained,
Yeah.
because they have taken one method before and they have side effects. They use it to generalize that no, you can. So those are issues that we are having, and that is why when you want to choose a method, it requires family planning counseling, which should be given by trained professionals, such as a family planning nurse that has been trained, not just any nurse, a nurse that has undergone family planning training, physicians with interest in family planning services, obstetrician and gynecologists, because it's part of our training routinely, to provide family planning services. So those are the people that are qualified to give family planning counseling, and it takes a lot. There are a lot before you choose any method. we need to do a risk assessment. And that is why I'm equally calling, informing our viewers out there, our listener out there, that please, before you choose a method, don't just go to one pharmacy that I want to take this, I want to take that. You need consultation so that we can assess which one
It's best for you.
is best for you.
Yes, and our doors are open at Limi Hospital to come and get that consultation. Yes.
So that's one thing about it. There are even tools that we use in the clinic
Yes.
to do some risk assessment, what and what. So, okay, there's a question that what about men and family planning? The role of men in family planning cannot be overemphasized.
Cannot.
Oh, let me ask a question. Can the woman get pregnant without the input of a man?
No, it takes two to tango. No.
It takes two.
Yes.
So that's one thing. So when we are discussing family planning, we are not discussing women, no, we are discussing, men and women
Yes.
together. It affects
Yes.
the two sides.
Yes. Husband, you should support your wives in making the right decision.
And it's not
Yes.
only husband and wife alone,
Yes.
boyfriend and girlfriend.
Partners.
Partners.
Support your wife.
Yes.
Support your partners.
It's very important so that we prevent unplanned pregnancy that can result in, unwanted, in unsafe abortion. No, that's one thing. That's one thing about it. And I'm still repeating this. Women, our mothers, our sisters out there, please let's value our lives.
Yes.
Especially those, whether they're married and married too. Women health is important.
Yes.
But for the unmarried, the single, single ladies, please, if you are engaging in sexual activity, I am not saying it's bad, it's whatever, it's your choice, which you have right to do. Please be protected if you are not ready to get pregnant for your male partner. Because sometimes some of them, they just take off once there is unplanned pregnancy, or they will enforce you to abort. If there is complication, they don't, they leave you.
Yes.
They carry another one. So it's very important.
Please protect yourself. The smart move for any woman to make, get contraceptives.
Yes, and there are methods that can be used by men. We have discussed
Condoms.
Yes, for families, for male and female partners, couples that are using male condom, please, we need to use it the best way it should be used. Not just to just go and buy it. Is it not condom? No, we need to try and learn. You can see professional. We have things that we use to demonstrate how it should be used. Yes. So very important. And vasectomy is there too.
Yes.
It's not only a woman that should do bilateral tubal ligation. We can equally do vasectomy and cut our part different so that
And
can
it's good
continue
to mention here that it doesn't affect the feeling, the experience
it
of
does-
sexual intercourse.
It doesn't
All it
affect
does is just
erection.
interrupt the sperm entry into the ejaculate.
That's
But
it.
The ejaculation, the entire feeling you get from sexual intercourse is still retained. It doesn't even drop your hormones, doesn't drop your sex drive. So those are just some myths out there that make some men who would have wanted to opt to this option and save their wives, who for some reason, some women, like we're going to discuss soon, there's some women who don't even meet any of the eligibility criteria to get any of the contraceptives. So in that case,
Yes.
the husband can help us.
Like you mentioned, eligibility criteria. There are certain things we look out for. Some people have been asking, hey, if you take contraceptive, it's going to cause breast cancer. If I take contraceptive, it's going to make me to develop BP. If I take contraceptive, it will not make me to get pregnant. That it can cause all sort of health challenges in the body. It's not always so. But if you have any doubt, you can come to Limi Hospital. We have time for you. We are there. We are actually expecting. We are there for you. So come, let's interact and work together. There is a question out there too that what about the side effect that comes with the contraceptive? Do you expect the woman to go through testing, all the contraceptives?
No, this is not experimentation.
No.
You're not a guinea pig or a lab rat. That's why we expect you to come to Limi Hospital and get a consultation with our trained family planning nurses, our obstetrician and gynecologists, and our trained physicians who are interested in family planning. When you come, we're going to do a risk assessment for you, like Dr. Taiwo mentioned. And in that risk assessment, we'll be able to help you know the kind of family planning that best suits you and best suits your health condition, so you'll be able to ameliorate the side effects and still get the benefits required from family planning.
Well, let me just add this to what my sister here had already said. One of the issues we are having with family planning is side effects.
Yes.
And that is one of the reasons why most women discontinue family planning. But they discontinue it because they might have not had good counseling before they opt out for whatever method that they are using. So when you know what to expect, what are the potential side effects you can have from whatever method you are choosing, that will help you. There are some side effects that we talk about it, they are common to a particular method. We talked about it, some are so tolerable, we let you know and we discuss it. When you are having it, you have to come back to clinic, you understand. But most of the side effects when it comes to family planning, they are tolerable, they are something that the woman can actually bear. Some of them are just because you are just getting to use that family planning, your system is trying to adjust to it.
Yeah.
Most time within 3 to 6 months, those side effects you may not see
Yeah,
it.
like IUCD, some people have heavy menstrual bleeds initially, and
Yes,
then later on it just normalizes.
yes, that's one thing about it. So please, we don't do come and test this one, come and test that one. No, but sometimes if the side effects are something that you cannot cope with, you understand, we encourage that we change method, but we don't do shopping. Let me, as if we are in the boutique, let me put on this one, does it size me or not? No, where we do that is when you are doing your counseling, we do that risk assessment, and we use, if you're having some pre-existing medical condition, take for example a diabetic patient, an hypertensive patient, a woman who is 35 years and above, a woman who has severe migraine, a woman who has family history of breast cancer. We will not want you to use combined oral contraceptive pill.
Yeah.
You understand? And some others, don't let us start discussing all this one because we will not even go there if we are discussing that. But please, don't let us generalize. Let's come and we have interactions together. You can clear all the doubts. Eh? And I want to encourage you, even when you are coming, do your research well.
Exactly.
Write your question out so that you won't
can
forget
read
any.
around the topic.
Yes, we
Information
discuss
is as
it.
close as the next swipe on your phone now. Information is at your fingertips. So you can do your research and come with all your questions. Rest assured that we have trained professionals who will be able to answer your questions and clear your doubts.
No, that is it, though, because it's not family planning that every woman can use. You know, the way World Health Organization in 2015, they brought out what we call a wheel, like a cycle like this. Eh? They categorize them into four categories. We have the one that you use method in any circumstances. We have the one that you generally use it. We have the one that you only use the method. That is category three. You only use the method when there is no other one, and the benefit of using the method outweighs the risk of not using. You understand? That is when you use it. And we have the category four that you don't even use at all. So that's one thing about this. So we looked at all these things before we now finally come down. Even when a woman comes to the clinic, and there is a way we help, couples to choose a method. After you have concluded, after giving you information about various methods, and you have concluded on the type that you want to choose, then we can now discuss in detail the nitty-gritty of that method. If there are things, we give you information, and then you not be in doubt now.
Yeah.
You know what you are opting for. So that's what we do. Mm.
That's awesome. So we have another question here. Before we go into that, let's reintroduce ourselves. My name is Dr. Blessing, personal physician, Limi Hospital.
I'm Dr. Taiwo, consultant obstetrician and gynecologist, Limi Hospital,
Yeah, we're discussing
Central Business District,
Yeah,
because it's
Central-
important so that people will not go.
Please, don't go somewhere else.
And the good thing about it is that our hospital have three branches.
Yes.
We have the Limi Hospital
Yes.
in Central Business District that has to do with family planning, gynecologists, general medicine, is there. We equally have the children hospital.
Yeah,
You understand?
pediatricians.
So for children,
Yeah.
that's it. We equally have the cardio care where we do all the internal medicine, cardiac intervention.
Yes.
That's one thing about it. But where you can readily access family planning services is Living Hospital Central Business District. So that's it.
So we hope to see you there. So we are still expecting your questions in the comment section. We're still discussing family planning here. If you have any questions, you're not sure of something, please go ahead and ask. It's better to ask us. People say this jokingly that you wouldn't take your car to someone who's not a mechanic to fix it. Why would
Ah,
you take your body to someone who's not a trained professional to handle it for you? This is family planning we're talking about. This is your future you're talking about, and you just entrust into the hands of someone who doesn't know what they're doing.
let me tell you one of the reasons why people do that. Sometimes they think it's too expensive. No! Ignorance is even much more expensive.
Yes.
You understand? Our services affordable. The benefit of it is very, in fact, it's something that it outweighs, you get value for the money you are paying.
Exactly. We'll have another
So,
question here.
all right, what about it?
Yeah, it says there means that we can use to tie the womb as a part of our contraception and birth control.
Yes, we've talked about permanent method, which is a bilateral tubal ligation. So we have bilateral tubal ligation, various methods, various things. I don't want us to discuss that here. How we tie, but the main thing is that we disconnect the tubes so that we prevent sperm from reaching egg. There are the ones that have been done before, but presently we are no longer doing it. It was withdrawn too. There is what we call a shell that can be inserted through the uterus, through the cervix into the uterus. We call it ishor. It has some coils like this that we put inside the fallopian tube. It helps to stimulate blockage of the fallopian tube. When they were using that one, for 3 months, they need to be on another form of contraceptives. It's going to be after 3 months that you need to demonstrate that the fallopian tube has actually been blocked. Or else, if you have just put it and you dey jollof oga oga dey jollof madam too, belle fit result too. And when belle results, most times it can be a ectopic pregnancy that will still require some other surgery. So that's one thing, but we don't routinely do that
Yes.
now.
So now we just tie the tubes. Yes, it's possible to tie a tube in form of birth control. So please keep your questions coming. We would love to hear from you. Please put your comments in the comment section. Give us a like, give us a share, please. And we hope that you're here with us next week Friday. We'll be discussing another hot topic here at Limi Hospital and Instagram Live. So, could you tell us some more benefits of family planning?
Ah, the benefit of family planning is, it cannot be overemphasized. The benefit is so much that, for me, the first benefit, if you ask me, because I used to tell people I'm a woman in man body because um a reproductive health physician. You understand? I take care of women health, so I think about women and their reproductive care. So that's just it. It helps a woman to be in control and serve oga well. Like I used to tell our women in the clinic many a times, oga too will start crying and begging madam, please, is enough. When madam has not reached the peak, you don't understand. Oga don for where you no go stop. No be only you go enjoy. Na e help a woman to enjoy her husband well. You understand? So take care of a woman's anxiety.
Stress.
You understand? Stress of a woman. So that's one thing. It helps child spacing. You don't just, sex. That's sexual activities, coitus is one of the things that helps family, brings husband and wife together. You understand? So one thing about it is that when you are having sexual activity, pregnancy is bound to happen.
Exactly.
So, and you don't want to have children, more than that you cannot afford to care for. So it helps child spacing. It helps you to be in control of, oh, we want our one child to be 4 years old before another one comes, or we want 5 years. It equally helps most career women
Yes.
to equally be in control and help their career, advance their career. Because a woman in school now, she wants to write her exam and she's suddenly pregnant. Pregnancy comes with a lot of changes, including their emotions, their psychology, and the like. All those one, it helps them. Okay, it equally helps even women to recover from the effect of the previous pregnancy. That is why most times when we see a woman that is gram multiparous, that is 5 or more, sometimes one of the risks that they are bound to face is anemia in pregnancy, because their body might have not recovered from the effect of the previous pregnancy before they got another pregnancy. So it's very important. So it helps them to recover fully from the effect of previous pregnancy. And some people have they had their turbulent pregnancy,
Exactly.
delivery, and post-delivery, which we call the preparatory, period. So we need them to fully recover. Sometimes some people have cesarean section and it may be complicated. Some people have infections. Some people have high blood pressure in pregnancy that want them to recover first. All those ones. Very, very important. So it helps them. It equally helps the finances of the family.
Exactly.
You don't give birth to more than what you can take care of, more than what your resources can take care of.
Yeah.
And by extension, it equally helps, the community.
Yes.
You don't have more than enough. There are some children that, because the parents are not taking care of them, they become nuisance to the community. And they become problems in the entire country too. It equally helps the country too. That is why we are equally saying that nationally, our government, even in the state government, they need to look into this.
Yes.
We are talking about population explosion where we started from. You understand that our population is increasing drastically now, and we don't have adequate planning to take care of, the number, our population. So contraceptive method is a way, and that's why if government makes it free, available, and affordable to couples, not just women. You understand? It will help to control our population too.
Yeah.
So it's very important.
So you should see family planning as a seed you're sowing for your grandchildren and great grandchildren, because by you working mindfully to reduce population by your actions and decisions, you're ensuring that the planet is more safe and inhabitable for them in the future.
Yes, very important. And some women too, they equally have some pre-existing medical conditions that when they get pregnant, the condition can worsen in pregnancy. So we want them to use family planning so that they don't get pregnant until their health challenges have been taken care of. So that by the time they are pregnant, it will help them.
Okay. So we have another question here. Does family planning interrupt love making? Like we just said earlier, family planning actually makes love making more enjoyable because it takes the stress and anxiety out of it. That's stress and anxiety of getting pregnant. However, having said that, some methods of family planning, like the coitus interruptus, the withdrawal method, where the man has to, that's one of the natural methods. The man actually has to withdraw before ejaculating into the woman. And then for the condom, like you mentioned, where you have to be erect before you put on the condom, and you still have to be erect before you take it out. So in that way, it can interrupt the spontaneity of lovemaking, which can actually somewhat affect the pleasure of lovemaking. But with more consistent use,
Yes.
consistent and correct use, you learn from your mistakes. I think it's like riding a bike. Initially, you fall down and get some scrapes, and later on, you're able to ride well. You enjoy that ride.
That's
so with
it.
more
That's
use,
it.
consistent and correct use, you can get to enjoy your lovemaking.
And especially if you are now using long-acting reversible contraceptive
You don't have to
method,
bother about that.
like the 3 monthly,
Yes.
2 monthly injection,
Yes.
implants that can last 3 years or 5 years,
Yeah.
IUCD that can last up to 10 years.
Exactly.
You understand? Or in the vaginal ring,
Yes.
especially the progesterone vaginal ring that can last up to 3 months.
Yeah.
When you are using all those methods,
You don't have to.
you
even
don't
bother
have
about it. I
any
like the
worry.
term that was called "pit and forget." So you
I'm-
just put it and then forget
I'm
about
telling
it.
you.
Yes.
Yes.
Exactly. Okay, we have another question here. Does family planning harm the uterus?
Oh,
I'll let you answer that, sir.
family planning doesn't harm the uterus, so it actually helps the uterus, because when you now go for illegal or unsafe abortion, your uterus can be harmed.
Yes.
We have some people that their uterus have been badly damaged. Some have had their womb removed because in the process of family of unsafe abortion, they have perforated their uterus. Their uterus become infected. It become gangrene, meaning that it died, and then we need to remove it. If not removed, it could have killed the woman.
Yeah.
So sometimes that is what used to happen. But family planning doesn't harm the uterus. You understand? So very, very important.
So does family planning cause infertility? Is another question.
No, family planning doesn't cause infertility. No. It doesn't cause infertility. However, sometimes, especially a few methods, like when you are using injectable, the 2 monthly or 3 monthly injectable, sometimes there may be delay in return to fertility. So we will not say that it caused infertility. It only delayed it. And most time within 3 to 6 months, that is when you have that delay associated with the 3 monthly or 2 monthly injection. So after that time, of course, ovulation. And what does happen? Because the means by which they suppress, they prevent pregnancy, unwanted pregnancy, is by suppressing ovulation. So before the return of ovulation, it takes about 3 to 6 months, sometimes in some people. It's not in all people, because we have some people that are using this 2 monthly or 3 monthly injection, and they delay like 1 or 2 weeks like this. Hey, they're pregnant.
Yeah.
So that's it. It doesn't
So
cause
it's not one
infertility.
size fits all.
No, 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 no. But you can just delay for a few months. So that's one thing about it.
Okay, so
Mm.
we're still expecting more of your questions in the comment section. Please don't forget to like, share this with a friend who would love to hear about family planning. Please, our sisters, our friends, our mothers and wives and brothers too out there, please ensure that you educate your family members about family planning. Please join us every Friday, 6 p.m. as we always discuss exciting hot health topics. Health is wealth. It's important to take care of your health. That is your future. This is the only body you have. You need to care for it so you can use it to do what you come here to do as a human being and impact society and that.
Very
Yes.
important.
Dr. Blessing here, still from Limi Hospital.
Yes, Dr. Taiwo,
Yeah.
Limi Hospital. Let me share something with you. Sometimes, there are some women that, in the course of my practice, I've seen some women that will say that, oh, my husband is not at home. Oh, that's why I don't need to use family planning. But those men is even more dangerous for them. You know the reason? The reason is that when Oga comes, will you say Oga that has traveled maybe for like 2 or 3 months is now back, and you are saying, no, withdraw, don't put it, don't enjoy. No, you equally even want to enjoy Oga before Oga travels again, another 2 to 3 months or 1 year. You understand? So it's important that we use an effective family planning method.
So we have another question here. Someone says, I have been on contraceptives after I had my second child, but for the past 2 years now, I and my wife have been trying to get another child to no avail. Sir, what do you say to this question?
Please, I will encourage that you please see us. You see gynecologist. Yes, we are available at Limi Hospital. That's why we are there Monday to Friday, 8 a.m. to 5 p.m. We are always there. We need to look beyond, the family planning that we use. So it's very, very important. We'll be expecting you if you have the opportunity. We are at Central Business District, Constitution Avenue side. So please check on us, and then we'll be able to at least interact and resolve this issue. Very important. Once again, I'm Dr. Taiwo, consultant obstetrician and gynecologist, Limi Hospital, Central Business District, and with me is
Dr. Blessing, personal physician, Limi Hospital, Central Business District.
So I hope we have enjoyed our live session today. Like we said before, we cannot exhaust everything here today. We will have more time for you. You can just make out time to check with us. We'll definitely have more time to interact together. We still have 10 more minutes. You can keep your questions coming. We want to interact. We want to, please ask us any questions. So very, very important. And every Friday by 6 p.m. we discuss different topics as it affects our health. Very important. Sometimes it could be like we are discussing family planning. Last week we discussed mental health. Next week we are going to be discussing another topic. It is always an interesting time about our health. We are not even, this one is free of charge. We are hearing directly from professionals. Very important, and you can ask questions. We will guide as much as possible. So this is what we do, and part of Limi Hospital contributions to our society to enlighten and educate people on their health. So it's very important.
Yeah. So I just want to ask you a few questions. So say someone is a smoker, has been smoking for maybe 15 cigarettes a day or so for a long time. What kind of method of contraception would be best for that person? Is that person still eligible to use contraceptives?
Yes. We've discussed the various forms: natural, barrier, hormonal. We've discussed the intrauterine contraceptive device. We have discussed permanent method. You understand? Of course, part of the method that is safe for that person will be intrauterine contraceptive device. Barrier method can equally be used, but just that they are associated with a lot of failure rates. You understand? Permanent method can equally be used. The wife can take a bilateral tubal ligation. The husband can actually do vasectomy. So that's that. So there seems to be no condition that will not, that will not be able to have a particular contraceptive method that can be used. So that is why, no, don't say that there is what we call unmet need for contraceptives. And what do you mean by that? They are the people that are having sexual activity
and I need a contraceptive.
Unprotected sexual activity without being on any form of contraceptive, but they don't desire to have babies, to have pregnancy. So that is the unmet need. So instead of doing that and you are panicking every now and then, take up an effective contraceptive. You know, that will help. Yes.
So, okay. So someone's asking a question here. Does sugary drinks affect fertility? Okay, so you are here. A lot of myths about sugary drinks out there, ranging from cycles and menstrual pain and all that. Now we're talking about infertility. Does sugary drinks affect fertility?
Sugary drinks
Yes.
doesn't have a direct bearing on fertility. However, it's been noted that among people who have diabetes, you understand, of course, sometimes the fertility potential too is equally reduced because diabetes generally reduces body's immunity. You understand, it can expose the woman to infection. Of course, it can, in a way, predispose the woman to pelvic inflammatory disease. You understand? So that one that can equally affect some part of the reproductive tract too. So that's one thing about it. Ask now. Plenty people, in fact, the person that asked this question, go and ask. There are a number of our friends that are taking, they are living on sugary
They are
drinks,
pregnant and they are still
and
doing them.
they are like touch and carry. Some people will say I'm like a pig. When you touch me like this, even when I'm menstruating and I'm touched, I'll get belly. Someone like that. So that's one thing about it. But you can come so that we can discuss it one on one as it affects you. It's very important. One on one conversation with trained professional like what we have in Limi Hospital Central Business District is important. You know,
So,
that
sir, we'll be wrapping up really soon. I want to just throw a question. I'm sure some of our viewers are wanting to ask. So, do contraceptives help prevent sexually transmitted infections? How can we ensure that we don't get sexually transmitted infection? Because one thing about talking about safe sex is not just the ability to prevent pregnancy; it's also the ability to prevent sexually transmitted infections and HIV.
one thing about it is that there are forms of contraceptive that can actually help to prevent sexually transmitted infection that can result from pelvic inflammatory disease as a result to pelvic inflammatory disease and impair the menses of a woman and fertility potential of a woman, such as male condom and female condom. Those are the two that have that potential to prevent sexually transmitted infection. And how do they do that? They prevent sperm from entering the vagina of a woman. So they help. That's one thing. But a consistent and correct use of it is important to ensure this function is achieved. And where some people used to talk about, hey, contraceptive and you can expose one to sexually transmitted infection is because sometimes some of us have multiple sexual partners. We carry here, we carry there. Whether a man has more than one woman that he sleeps with, or a woman has more than one man that she sleeps with, she's at risk of having sexually transmitted infection. And in that case, we recommend that they use condom. So very, very important, whether male or female condom. But I know that male condom is readily available. It's there every nook and corner of the country, so you can easily get it. It's available in our place too. We can give you. Don't worry, you are protected.
Yeah.
You put it in your pocket. You are protected. Yeah,
And you're ready to go wherever you are.
Abi.
So this is Dr. Blessing Eshiash from Limi Hospital, personal physician, and this is Dr. Taiwo, obstetrician gynecologist. We'll be discussing about family planning here. We'd love to hear more from you in the comment section. We have a few minutes left to go. Don't forget, they can come to Limi Hospital Central Business District and get your counseling for family planning with trained professionals, family planning nurses, obstetricians, and gynecologists and physicians who are there to help you in a serene and caring environment.
You will never regret that you have come to visit us. That's one thing. You will smile out like a woman that I had to cancel today. She didn't want to use. The most joyous thing or the happiest moment of that encounter was the fact that Madam said, now I have more information. I'm going home to discuss with my husband. I will come back after our discussion. That's one of the things that happen. It does happen virtually every day when we see our women, coming for maybe postpartum visits or some other services, and we discover that there is a need for them to be on an effective
Exactly.
contraceptive.
Information is
So
power,
that's it.
and it's important to be armed with the right information, especially health information. And we can offer this at Limi Hospital and even health services too. And we also have a cardiac care facility where we have internal medicine specialists and we perform cardiac interventions. And we have our Limi Children Hospital where we attend to all our children. But for family planning services, Limi Hospital Central Business District is where you have to come. So, do you have other things you'd love to share with our viewers? We'll soon be leaving.
Let them come around. We can't exhaust information about family planning, but we are waiting for them.
Exactly.
That's why every day we wake up, we dress up, and go to work,
Exactly.
expecting them to visit us so that
Exactly.
we can positively affect our their lives.
Yeah.
Very important.
So we're waiting for you with a smile on our faces. Please don't forget to join us every Friday by 6 p.m. We'll share wonderful health topics here that you can just invite your friends. I'm sure you want to enjoy this with your family and friends also. So Dr. Taiwo, it's been a very lovely time here.
Yeah, that's it.
Yeah.
So thank you.
Thank you so much.
Thank you.
Okay. So we'd love to see you back here next week, Friday, 6 p.m. with Limi Hospital on Instagram Live to enjoy another hot health topic. Thank you so much, everybody.
Bye.
Bye.